So good evening, everyone, and welcome to this information session on Deakin University's Doctor of Medicine program. My name's Gary Rogers, and I'm the Dean of the School of Medicine here at Deakin. Presenting with me this evening will be Associate Professor Janet McLeod, who's the Associate Head of School for Student Recruitment for the School of Medicine. As we begin this evening, we'd like to acknowledge the country on which we're gathering. As we gather for this meeting, physically dispersed and virtually constructed, let us take a moment to reflect on the meaning of place, and in doing so recognise the various traditional lands on which we do our business today. We acknowledge the elders, past, present and emerging, of all the land on which we work and live, and their ancestral spirits with gratitude and respect. I'm coming to you today from the Warren Ponds campus, which is on Wadawurrung country. To the next slide. So this evening we're going to be presenting to you about the program and how people are recruited into the medical program at Deakin, and then we'll be able to answer your questions. So during the presentation, if you have any questions for either of us, then use the Q&A icon at the bottom of your screen, and we'll be answering as many questions as we can. You'll also have the opportunity to upvote a question to make it more likely to come to the top of our list at the end of the session to answer for you. The presentation will be recorded, of course, and you'll have a link to this recording after the event. When we come to the questions part of the evening, Janet and I will be joined on the panel by Rachel Mahoney, who's a Year 3 student currently at Geelong Clinical School in our medical program, and Claudia McLean, who's the Administrative Coordinator of Selection and Placements for the school. So we'll all be available to answer your questions. I just suggest to you that you don't ask questions about your own particular situation. Those questions are obviously of a more private nature, and they can be answered directly with the email address that will be and telephone number that we'll give you at the end of the presentation. But if you have some general questions that you think will be of interest to other members of the audience, we very much invite you to put those in the Q&A box as the evening proceeds. So on to the next slide. So I guess I better introduce myself. As I said, I'm Dean of the School of Medicine. I'm not surprisingly a medical practitioner. I'm actually from a general practice background, and I'm a registered specialist in general practice, but my clinical work for about 20 years now has focused on HIV medicine, particularly in the context of general practice. And for the last 12 or so years, I've focused on medical education and health professional education. I've been in the role of Dean now for about 11 months, so I arrived at the school right at the height of COVID, so it's been a very interesting time to get to know the school, but we'll be telling you a bit about the school and the program this evening, and then we'll go through some of the specifics of how people are recruited into the program. Okay, let's go on to the next slide. I guess I want to talk first of all about Deakin School of Medicine and what it is, and I guess how it's different perhaps from the other medical schools in Victoria. We would like to think of ourselves not as the third Melbourne Medical School, pointedly not the third Melbourne Medical School. We're something different. We're focused on our part of the world, we sit with headquarters in a regional town in Geelong, and a footprint of work in southwest Victoria in the Grampians region, focused on rural and regional Victoria. We do have a clinical school in Melbourne, but our focus is particularly on that part of the world. And I guess our vision involves a focus all the time on the reason that we're actually here. So we're very focused on our purpose, which is to enhance the communities we serve through outstanding clinical training and research. So we're focused on the well-being and the health of the people in our region, people who live in rural communities, in regional communities, remote and Indigenous communities, and also marginalised individuals and communities. So we're here to make a difference in the world and to improve the health and well-being of humans, especially those humans who are disadvantaged in some way. We're a very values-driven school, and we do foster a culture of diversity, inclusiveness, respect, and social accountability. Yes, we're about excellence and innovation as well, but we're very much driven by our values, and we definitely want you to be ready for your practice as a medical practitioner if you graduate from our medical program. On to the next slide. So our program is very focused on the capabilities that you will need to be a good doctor. And those capabilities span all of the domains of learning, really. Obviously, you need a good understanding of the science that underpins medicine, but you also need some skills, some abilities that you've trained and practiced to be able to do effectively, and those include skills in communicating with patients and colleagues effectively, undertaking medical procedures and those kinds of things. But the third domain, the values domain, is also important. So we will help you to gain the value set that the community expects of its medical practitioners. We'll give you some training in health research so that you can base your practice on the evidence that distinguishes the medical profession. We have a focus on chronic disease prevention and management because so much of the burden of ill health in our world today these days is related to chronic disease and complex multiple diagnoses in the same person. We have a focus on longitudinal and community-based care, so a lot of the learning takes place in the community, and you'll have the opportunity to follow individuals through their progress with a health problem so that you learn about them as humans as well as people with an illness. We're interested in professional learning. We'll want you to be able to work effectively with health practitioners from other health professions because that care, especially in the context of chronic disease and complexity, where particularly older people have multiple medical problems going on at the same time, we need more than the skills just of doctors to care effectively for people in those circumstances. And you'll need to be able to collaborate effectively with your colleagues from other health professions. And as I alluded to before, we have a particular commitment to serving rural communities and First Australians who, as you know, experience health inequity to a very large degree in Australia still today. On to the next slide. Thanks, Jenna. So what about you? We're very keen that our students come from many diverse backgrounds. In my experience as a medical educator, some of the very best doctors have been people who have come from a non-traditional background. So not necessarily a medical science background. In fact, some of us would even think that a medical science background is probably a bit narrow for making a good doctor. So we very much encourage people to come from other fields, other undergraduate degrees, because you bring different kinds of life experience. Those of you who are scientifically inclined are of course very inclined, are of course very welcome, and we'll have your richness adding to the group-based learning. But we particularly encourage people from backgrounds that wouldn't traditionally be thought of as pre-medical backgrounds to join our medical program. Thanks, Janet. And why would you choose Deakin? Well, I guess you might choose Deakin because your interests and your values align with what we just talked about what makes us a different medical school. But also our students are pretty happy. Deakin University has been the #1 university in Victoria for student satisfaction for the last 11 years. And I have to say, having come recently to the school, one of the things I've been really struck by is that there's a very strong sense of partnership and collaboration between the students of the school and the staff of the school. It really feels like a community where we're working together for a common purpose. And I guess that goes with that focus that I talked about before on what we're actually here for. What we're actually here for is to help the communities we're going to serve. And we do that through training excellent doctors, as well as doing great research and training professionals in other health professions as well. Next one, thanks. So Deakin underpins its medical program with a very strong program of medical research and clinical practice. We have the Impact Research Centre, which is extremely successful, relatively recently formed in its final form in the last few years, but has been enormously successful in garnering support, with a focus on the nexus between mental health and physical health and how those two interact with each other, an increasingly important area in the world today. Within Impact is the Geelong Centre for Emerging Infectious Diseases, And I guess none of us need to be reminded about the importance of infectious diseases at this point in history, when a particular infectious disease has changed our world almost unrecognisably in the last 12 months. We work closely with the Western Alliance, which is an integrated health research centre that focuses on the western part of Victoria, and has a focus on particularly rural health. And we have our own centre called Deakin Rural Health, which is a university department of rural health within the school. We also auspice, in partnership with Western District Health Service, which is in Hamilton, the town of Hamilton in Western Victoria. We auspice the National Centre for Farmer Health. So that has a focus particularly on people who live on farms and in farming communities rather than in rural towns. As you may know, farmers experience, again, a whole range of health inequity. They have higher rates of a number of health problems than even the people who live in rural towns, let alone the people who live in the cities. So farmer health is a really important area that we focus on in our research, and that research underpins and keeps current and keeps vibrant the learning that you'll have in the medical program. The next one, thanks, Janet. And we do all of this work, of course, in partnership with our colleagues, and that includes our clinical colleagues, our scientific colleagues, and our international colleagues. We have clinical schools that Janet will tell you about, based at Ballarat and at Warrnambool, and then we have another clinical school that works across multiple rural centres, as well as a school in Melbourne, and the largest school, which is in Geelong. But we work in partnership with the health services at each of these sites, Bowen Health, of course, in Geelong, the CSIRO, the Commonwealth Research Organisation, Epworth Geelong, which is a private hospital right next to the Warren Ponds campus. Our partners in Warrnambool, the health service there, St John of God private hospitals, and many primary healthcare providers. So there are lots of placements in general practice, and Janet will tell you a bit more about those in a moment. We have some strong international partnerships, and certainly in normal times, a high proportion of our students undertake electives overseas, so with our partners in Denmark or Sweden or India or China or other places in the world. A little less so at the moment for very obvious reasons, with the borders being largely closed. But we hope by the time you reach the stage in the medical program when you'd be able to take an elective, that program will be back up and running again, and we'll be re-engaged with the broader world, because we have some very strong partners around the world. So I'll wind up there, and I'll hand over to Associate Professor Janet McLeod, who'll tell you more about the medical program itself, and then about the selection and admission procedures. Thank you.
Thanks, Gary. Hi, everyone. Good evening. So I'm going to start with talking about the themes in the Deakin curriculum. So there's 4 key themes that run throughout the Deakin MD. These include the medical science and clinical practice theme, and this focuses on the biological and behavioural sciences that underpin the practice of medicine, along with the skills required for effective person-centred healthcare practice. We have a really important theme in our program, as Gary's alluded to, in Indigenous Health, which aims to address social, political, environmental and economic determinants of Indigenous health through appropriate clinical management, community development and cultural safety. We also have a theme on ethics, law and professionalism, which focuses on the foundational and applied concepts required for the ethical basis of health, the social and legal frameworks of medicine, and the professional practice of medicine. And our public health medicine theme, which encompasses healthcare from a community and societal perspective, including epidemiology, population health, health systems, and the ways in which healthcare practitioners can support better health outcomes, not just at the individual level, but at the global level as well. So the MD program runs for 4 years. The first 2 years are the Foundations of Medicine component, and this is based at the Geelong Warren Ponds campus. These 2 years use the different physiological systems as frameworks for delivering each of the course themes. In years 3 and 4, students are allocated to clinical sites to undertake the professional practice of medicine component, and I'll explain more about the clinical sites shortly. But in year 3, students undertake 6 7-week programs or rotations in the specialties of medicine, surgery, children's health, and women's health. And these can take place within a health service, or a group of students undertake a longitudinal integrated clerkship where they're based in a rural or regional location, working closely with a GP associated with a local hospital. In the longitudinal integrated clerkship, students cover each of these specialties here across the entire year rather than in discrete 7-week blocks. In Year 3, students also develop a research project through the Research Scholar program, which they'll develop over the course of their clinical training. A program where students follow a patient's health journey across the course of the year is also a feature in Year 3, and this is to provide students with a deeper understanding of the patient's experience across the healthcare continuum. In Year 4, students continue to build on the primary clinical training to consolidate their skills in 5-week rotations in the disciplines of general practice, emergency medicine, anaesthetics and intensive care, aged care, rehabilitation, palliative care, and mental health. And in addition to this, there's an additional dedicated block where students finalise and present the findings from their Research Scholar program. And the final part of the year is a capstone opportunities for students to be involved in their pre-internship or preparation for intern year and an elective opportunity. I'll explain more detail shortly, but our students who are successful into entry in the rural training stream will undertake both Years 3 and 4 of their studies in a rural or regional clinical school. As I mentioned, Years 1 and 2 are based at the Warren Ponds campus, and we have well-established teaching spaces and facilities to deliver our program. Students will also get early exposure to clinical experiences through our placement program. And teaching in Year 1 and 2 is through integrated system blocks, so using small group problem-based learning for students to work through a clinical example. Tutorials, lectures and workshops in anatomy and clinical skills and communication are also provided to complement that learning. As I mentioned, the first year of professional practice of medicine in the clinical schools focuses on the specialties of medicine, surgery, children's health and women's health. And embedded within each of these are the themes of the course, including the public health medicine, including ethics, law and professionalism and Indigenous health, but also the disciplines of pathology, imaging, pharmacology, as well as the Research Scholar program and that longitudinal primary and community care program that Gary has also mentioned. This continues into Year 4 with consolidation of the Year 3 skills in the areas of emergency medicine, mental health, anaesthesia and intensive care, general practice, aged care, rehabilitation and palliative care, including the themes, disciplines and Research Scholar program. So we have 5 clinical schools in the Deakin MD, with our largest, the Geelong Clinical School based in Geelong. We have a smaller school at Eastern Health Box Hill, and our 3 rural schools in Ballarat, Warrnambool and the Rural Community Clinical School, which incorporates a number of sites in the Western Victorian region. Potential applicants will also note there's potential opportunities to undertake a rotation in Darwin as well during 3rd year. So to give you a little bit more information about the Rural Community Clinical School, it specifically supports students who elect to undertake their longitudinal integrated clerkship in their 3rd year. Students spend all of Year 3 with a group general practice associated with a local hospital. And students have the opportunity to work with both primary care practitioners and visiting specialists. This is a really amazing opportunity for one-on-one teaching, and also a learning opportunity for approximately 20 students, and they may be placed in towns including Bacchus Marsh, Camperdown, Colac, Daylesford, Hamilton, Horsham, Portland and Stawell. At Deakin, we have a strong focus on primary and community care within our program, and this is provided through the general practice rotation in Year 4 and the longitudinal primary and community care program in Year 3. We have an emphasis on students' understanding of the patient's experience of the healthcare in different settings, not just the hospital setting, and we also want to focus on how we can best manage chronic illness. The Research Scholar program runs throughout the MD, with students undertaking basic training in research skills early in the Foundations of Medicine program, leading to the advanced knowledge of health research principles and methods during their clinical years, which students will then apply to the practice of medicine in the areas of public health, health ethics, law, or professional practice. As Gary has said, we welcome students from all backgrounds and foster a collaborative and supportive learning environment. Our program provides training on professionalism, and we help students build skills in self-regulated learning. Recognising the challenge in undertaking studies in medicine, we offer academic mentoring and remediation programs to support students who may be experiencing difficulties in their learning. The school also has a dedicated school counsellor who is not associated with the teaching and assessment within the program to offer additional support to students who may be experiencing personal difficulties. And as Gary's also said, we have a principal vision of social accountability and a strongly embedded Indigenous health program to guide our students to become excellent doctors in the Deakin MD. Students and staff within the school are provided with cultural skills training, and we also have a dedicated entry pathway for Indigenous students to facilitate the training of more Indigenous doctors. So that's to give you a little bit of information about the program itself. Now I'm going to talk about the nuts and bolts of the admission and selection. So there are 3 entry streams for the domestic applicants to the Doctor of Medicine: the general entry, the rural training stream, and the Indigenous entry stream. We also have a separate process for international applicants. For 2 of the streams, the general entry and the rural training stream, applicants apply through the Graduate Entry Medical Schools Admission System, or GEMSAS, and applicants to the Indigenous entry stream apply directly to the School of Medicine. This is the first time we are offering the rural training stream, which we're very excited to offer, and I'll explain this in a little more detail shortly. So there's up to 130 places offered each year, of which 88 are unbonded Commonwealth supported places and 35 are bonded Commonwealth supported places. The bonded medical places are a Commonwealth supported place with conditions where a graduate will be required to work in an area of need within Australia for a predetermined period of time. We also hold a minimum of 30 of those allocated places to applicants from a rural and regional background. So at Deakin, we have no prerequisites to be eligible to apply to the MD program. Applicants from a range of educational backgrounds are encouraged, as we value experiences from across a range of discipline, which really enhances our student learning. For the 2022 intake, we have included the recognition of postgraduate studies for the first time as part of the qualifying degree. And it's important applicants should note that the grade point average calculations will be based on the most recent eligible 3 full-time equivalent years of study. If your most recent eligible degree is less than 3 years equivalent full-time study, the results from your next most recent eligible degree will be used to make up the remainder of that 3 years full-time equivalent to calculate the GPA. For example, if you completed your undergraduate degree in 2016 and then enrolled in and successfully completed a postgraduate level 8 degree in 2019, the results from your postgraduate qualification will be recognised as your most recent study towards your GPA calculation. If that most recent study only is equivalent to 2 full-time years of study, then the remaining 1 full-time equivalent year will be taken from the final year of your undergraduate degree. For all applicants, the qualifying degree must have been completed within the last 10 years. And for applicants whose degree was completed outside this 10-year period, you'll be considered if you have completed the relevant or recognised postgraduate study within the 10-year period. For example, if you did your undergraduate degree in 2011 but completed a graduate diploma equivalent to 1 full-time year of studies in 2017, your most recent studies from your graduate diploma will be part of your GPA calculation, and your 2011 undergraduate degree will be recognised as being current, with the complete GPA determined chronologically. So that is your most to least recent study equivalent to 3 full-time years. So if we go through step by step of the process, you need to complete a qualifying degree with the weighted GPA of at least 5. And as I've said, GPAs are calculated on the most recent 3 years of full-time equivalent study. And for those of you that are undertaking postgraduate study, please be aware that that postgraduate study must be successfully completed by 31st of July this year to be incorporated into the GPA calculation. It's also important to note that due to the impact of COVID-19, Deakin does not include 2020 results in the GPA calculation, and I'll explain that a little bit more in the next slide. So step 1 is a GPA. Step 2 is a completed and successful GAMSAT. I won't go into the details of the graduate medical schools admissions test, but note that is a requirement for our entry process. For the general entry and the rurals training streams, applicants must apply through the GEMSAS system, as we mentioned. The applications for both are the same, with the exception of those interested in the rural training stream will be required to include a short written statement which demonstrates rural community connection and a commitment to completing 4 clinical semesters in rural and regional Victoria. And again, I'll explain that in a little more detail shortly. So at Deakin, we also recognise that some circumstance may impact on an applicant's academic performance, and therefore we apply bonuses to offset this for ranking for interview. These include where applicants live. So for those living in rural and remote areas of Australia, as classified by the Australian Statistical Geography Standard, remoteness area, we offer a bonus. If your financial circumstances have affected your previous studies, we also value applicants' previous experience. So applicants with clinical experience as a registered ARPA professional, work experience. So we recognise the value that life experience can bring to the learning environment. And we also recognise our homegrown applicants. So if you are someone who lives in the greater city of Geelong region, or if you're a previous Deakin graduate. The GAMSAT, the GPA and the bonuses are aggregated to provide a rank for an interview offer. So interviews are held in September, and we offer 220 interviews for up to 130 places. The impact of the COVID-19 pandemic meant that we held our 2020 interviews online, and we've recently determined that we'll again hold our interviews in 2021 online, given there's still a bit of slight uncertainty regarding border closures and lockdowns. The interviews will consist of 6 5-minute stations addressing the following Deakin course outcomes, so communication skills, commitment to rural and regional practice, lifelong learning and critical thinking, teamwork, professionalism and health promotion. So the interview scores are added to the aggregate score and applicants are re-ranked for a place offer, and in November offers into the program are released. So as I mentioned, the constant changes and the impact caused by the COVID-19 pandemic in 2020, the school made the decision not to include 2020 results in the GPA calculation. The school believes that this is the most equitable and transparent approach to assessing all applicants, and to compensate for that removal, greater weighting will be given to applicants' previous most recent year of study. It's important to note that the approach of not including these 2020 results in the GPA calculation will continue to impact selection for a period of 10 years. Sorry, not 20. All right, so just a little bit more detail about some of the adjustments or the bonuses. So for work experience, if you've worked full-time for 2 years cumulatively over a 4-year period or 2 years consecutively, we offer a bonus of 2%. If you have 1 year's clinical experience as a registered ARPA practitioner or in speech pathology or dietetics, we'll give a bonus of 4%. Applicants need to be aware that you can apply for either the work experience or the clinical experience bonus. You can't claim both of those adjustments. To demonstrate financial disadvantage or receipt of a government benefit for 1 year during the most recent qualifying degree, we'll give a 2% bonus. And for our homegrown Deakin students, you need to have completed at least 2 full-time equivalent years of study in a degree at Deakin for a 4% bonus. And again, depending on where you live, according to the Australian Statistical Geography Standard, remoteness areas, 3 to 5, a bonus of 8%, and our City of Greater Geelong or an ASGS RA2 will get a bonus of 4%. Just to give you a little bit of information about this year's cohort, in the GEMSAS system, totally there were 5,701 applications received nationally. Of that, you can make preferences from 1 to 6 of the medical schools you may wish to apply for. Of that number, 4,431 applicants chose to preference Deakin 1 to 6. So my advice is, if you're keen to come to Deakin, pop us number 1 in your preferences. For a little bit of information, the average GPA of this year's Deakin MD first year commencing is 6.74. The average GAMSAT is 66.9. The average age is 24, and approximately half were completing their degree at the time of application. So a little bit more about the rural training stream. We're really excited about this. It's the first time we're offering it this year, but it's open to all applicants who meet Deakin's rural residency criteria, again, according to that Australian Statistical Geography Standard remoteness area. And you need to meet all of the other general entry stream criteria, which is the GAMSAT and the GPA requirements. You'll also be eligible for the same bonuses. The only addition is that written statement which demonstrates your connection to a rural community. And you apply through GEMSAS as per the general entry stream. Applicants need to note that in accepting that place within the rural training stream, you're committing to completing your 4 clinical semesters, or those 2 clinical years, 3 and 4, in a rural and regional Victorian training area. 30 places we're holding specifically for RTS applicants of those 130 places that we have this year. So for the Indigenous entry stream, its applicants apply directly to the school. Requirement is a demonstration of Indigenous background, a completed undergraduate or postgraduate degree, a grade point average of a minimum of 5, and applicants will undergo and be ranked for interview and aggregated in the same method as the other 2 streams. For those applying through international entry, it's again applied directly through the School of Medicine, a completed undergraduate degree, a grade point average of 5, and a GAMSAT of 50, or we will accept the MCAT, which is the international equivalent of 125 or greater in each of the 4 sections. International applicants are also interviewed and ranked as per the other entry streams. So just to give you some ideas of key dates, many of you will have been aware GAMSAT was tested in March. GEMSAS applications close at 5 o'clock on the 31st of May. You get a little bit of leeway to get all of your supporting documentation in. Offers are released for interviews in very early September, and we run the multiple mini interviews as we said then. In November, offer of places are released. If we don't meet our quota, we will offer additional places in December. And our course commences on the 24th of January 2022. Apologies. All right. And there's further information there. And remembering Gary said you'll receive a copy of this presentation, so you'll be able to look up those references directly. And now I'm going to ask Gary to come back in, and also Claudia will come onto the screen as well, or she'll talk to you all and manage your questions. And we also have Rachel popping in as well, our 3rd year student at the Geelong Clinical School. So over to you, Claudia, I guess, to give us some questions.
Yes, thank you, Janet. Thank you, everyone, for all the amazing questions that are coming through. The first one is a question for Janet from Ben. Are there any guaranteed entry pathways that ensure students a place in the Doctor of Medicine course, or is it necessary to do the GAMSAT and interviews for all pathways?
Well, there's no guaranteed pathway, Ben. Thanks for the question. It's an interesting question. The requirement is a GAMSAT, a GPA, and then you're interviewed. So even through the rural training stream, we still require the GAMSAT. Our Indigenous Health entry stream, we don't require a GAMSAT, but they are more than welcome to sit GAMSAT if they choose to.
The next question is for Gary from Caitlin. Does Deakin weigh the GAMSAT scores heavier than the GPA?
Thanks, Claudia. I'm going to defer that question to Janet, I have to say. Apologies. As I mentioned at the beginning, I'm relatively new dean at 11 months. So Janet will have the answer to that question.
Sure. So the question was in relation to whether we weight the GAMSAT greater, Claudia, was that the question?
The question was, does Deakin weigh the GAMSAT scores heavier than the GPA?
No, we don't. The GAMSAT and the GPA are equivalent, 25% weighted each, and the interview is worth 50%. So we recognise that both academic and your performance in an interview are of equal weighting in terms of your eligibility for a place.
Thank you, Janet. The next question is for Rachel from Eddie. What does a standard week of study look like for students in the first 2 years?
It's a really good idea, I think, to approach it like a full-time job. You often are in at uni most days. You get usually 1 day a week for the clinical placements. Some weeks you'll be on and some weeks you won't. So that can be a study day if you wish. But that's how most students that I know approach the course. I hope that answers your question.
Thank you, Rachel. The next question is for Janet from Sarah. Do you evaluate personal statements and prior life experience during the application process?
In terms of evaluating personal statements, no, we don't have personal statements. And in evaluating your prior life experience, that will be evaluated in your responses in the multiple mini interviews if you are successful to the interview process.
Thank you, Janet. The next question is from Lorna for Gary. How much study is now online after COVID? Will this remain the same moving forward?
That's a very good question. Certainly, COVID taught us a lot about how much of what we used to do face-to-face can be done effectively online. And I think we're still working this out, as COVID is not quite over yet. But I think there are many things that we learnt last year that will feed into the program into the future. For example, a lot of the large group teaching that used to be done face-to-face, we've found that student attendance is much greater and even engagement is greater when it's done online. So I think we'll be working through that over the next couple of years. All of our small group learning will be back to face-to-face. That's very important. Skills learning will be back to face-to-face as soon as we can make it that way, because putting your hands on is very important. But the large group learning, in fact, we may still have, when we're able to, some large group sessions, but in fact, the students seem to prefer the large group sessions to be online. I'd be interested in Rachel's opinion on that one too, actually.
I think you can get a lot from Zoom, but it's also really important, and I think you learn a lot from the clinical skills perspective if it's face-to-face. They both have positives and negatives, definitely. I was a Zoom student last year, but yeah, you enjoy the clinical skills in person, but it's great for the doctors even to be able to just Zoom in and teach us online. You can learn a lot from it too, but it's good to have a bit of mix, for sure.
Thanks, Rachel. And of course, almost all of your time in the third and fourth year of the program will be face-to-face because you'll be based in clinical settings. There are sometimes in some of the clinical schools, there are some tutorial type sessions that are done online because people are in different places, particularly the students who are in the rural community clinical school at multiple different rural sites. So they sometimes come together online and did before COVID. But most of the learning in years 3 and 4 is absolutely face-to-face and really can't be done any other way.
Thank you, Gary. The next question is for Janet from Prapti, and I apologise if I'm pronouncing that incorrectly. The question is, can someone who has graduated more than 10 years ago gain direct entry into this program?
So in order to make your degree that was greater than 10 years ago current, you would need to undertake some form of additional higher education study, and that would be equivalent to 1 year's full-time, and that has to be at a level 8 or higher. So that's from an honours, a graduate diploma, a grad cert, or a master's.
Thank you. The next question is for Rachel from Emma. How many clinical rotations do we have throughout the course?
So if we're talking about first and second year, you'll do some clinical placements within and around Geelong, because you'll all be based at Warm Ponds. Second year, you get a chance to go a bit rural and do a week placement, which is really great. Hopefully COVID stays down and you're allowed to get out there and do that. That'll be great. And then in the third and fourth year, you get to do a preference system, get sent to a clinical school, and then you'll be mainly situated there every day, working with the doctors there in the hospital. So it's a great experience.
Did you want to elaborate on the types of clinical rotations that you undertake, Rachel?
Sure, sorry, my bad. So in the first year, you do clinical placements out with GPs, so you'll go and sit with them. You'll do a placement with the ambulance and community nursing, so you get to just really understand what it's like to be in the healthcare system and with allied health across the board. And with the GPs as being the doctor as well. So it's a great opportunity to understand the wider concept, if you could say. Second year, I can't really comment on, but I know other students that did it and they loved it, going down to rural communities and interacting there. And then third and fourth year, you do like rotations in surgery, gen med, and women's and children's in third year. Fourth year, you do ED, ICU, and mental health. So you really cover a lot of broad areas across the 4 years, which is great. Is that better? Sorry about that.
No, all great.
I might just add a little to that if I may.
Yeah, go for it, Gary.
There are two ways in which the rotations in the clinical years work, especially in year 3. For students in the large clinical schools in Ballarat and Warrnambool and Geelong and Eastern Health, the students do those rotations. So they do a couple of rotations of medicine, a couple of rotations of surgery, one of children's health and one of women's health. But the students in the rural community clinical school use a different model, which is where they're actually based in a rural town, and they're based in the general practice there, but also that general practice services the hospital for that town. So they get all of their rotations, as it were, all mixed together in a longitudinal pattern, which allows people to actually, meet patients and then follow their journeys through time, as rural GPs do. So you get that rural GP experience. And the interesting thing is, I saw one of the questioners was wondering about whether students from who do a rurally placed training are disadvantaged into the future. That's absolutely not the case. All the research that's been done shows that those longitudinal rurally based models have people ending up with just as good capabilities, if not better, than the more traditional rotations through the different specialties in a larger health service. So that's a very interesting and exciting model that we think makes terrific rural doctors, and indeed urban doctors if people end up going back to the city after doing it.
Thank you very much, Rachel and Gary. The next question is for Janet from Ulrika. What should Year 12 students do now to gain the most direct entry pathway into medicine?
Well, for medicine at Deakin, I would say that you identify the subjects that you really enjoy in Year 12 and focus on those, and look to do an undergraduate qualification that you get the most excitement and that you really enjoy studying. That's really important, rather than just going down a specific thinking that you need to do certain science subjects or all sorts of things. Medicine is a very big discipline, and we value experiences from all areas. So don't feel that you need to just study maths and science. Please look at something that you really enjoy, and keep in mind that down the track when you apply, you just need to be able to understand what the requirements are for the GAMSAT, and also have a strong result in your academic performance in whatever undergraduate degree that you do. I hope that helps. Thank
you, Janet. The next question is for Janet or Rachel. Do you use case-based or scenario-based training for years 1 and 2?
Rachel, do you want to answer that to start?
Yeah, sure. So we do problem-based learning, PBL, in years 1 and 2. It's really fun. And you are put in little groups of about 10, and it's a mix, and you'll work together to go through cases each week. So you'll get presented the case on Monday, you'll work through it and work as a group to I don't know, find answers and learn about the problems and the issues that the patients are presenting with. And then on Friday, you'll come back as a group and you'll teach each other learning issues that you identified on Monday. And it's really good because a thing about Deakin, like Gary was mentioning in the presentation, is these groups are filled with a range of different people. So in some of my PBLs, I had physios. They're really great at muscles and movements. Ambulance drivers, so they're really good with clinical practice. Biomed kids are great with the physiology, and like engineers. So it's really great with working through those problems and those patients you're presented with. So it's good. Janet, would you like to add anything into my answer there?
I think you did a fantastic job, Rachel. I think that's right. And that's the whole purpose of really welcoming and encompassing people from different backgrounds, because it enriches that learning environment, and the perspectives with a particular clinical case that we study come from different areas. And so people look at them differently, and it helps broaden your knowledge and your experience in terms of how you would look at a patient. So we think that's really important.
Thank you, Rachel and Janet. The next question is from Nicole for Gary. If you don't have a rural training stream place, does that mean that your placements will be focused on main hospitals rather than general practice or regional hospitals?
So, sorry, so if someone's not in the rural training stream, is that the question?
That's right. So if you don't have a place in the rural training stream, does that mean that your placement will be focused on main hospitals rather than general practice or regional hospitals?
With regard to general practice, no, because all students do a placement in general practice in 4th year, and as Rachel was referring, there's an experiential placement earlier in the course as well. But that's only one rotation as opposed to that year-long possibility in the rural community clinical school. So the students who enter into the rural training stream, as Janet was alluding to, they'll only be competing in a pool with each other. They won't be competing with their educationally advantaged city colleagues. But they will be, if they enter that stream, they will be undertaking to do their 2 clinical years in a rural setting. Now, that doesn't necessarily mean a small rural setting, because we do have clinical schools in Ballarat and Warrnambool, as well as the Rural Community Clinical School, but they'll be undertaking to do that. So the first preference for those opportunities will go to the rural training stream students because they've made that commitment. They're unlikely to they won't completely fill all of those rural places. So there will be opportunities for students who enter through the mainstream to opt to go to rural clinical schools, including even the Rural Community Clinical School. We'll just have to allocate the places to the students in the rural training stream first. So they might be a little less likely to get them in that allocation process.
Thank you, Gary. The next question is for you again from Jess. Do you have an average, Do you have an average or maximum capacity of accepted applicants per year? Is it quite competitive to get into our course?
That one's easy, yes and yes. Yes, we do. We have a fixed number of places available each year. And as Janet showed you with those figures, there's always a very large number of applicants for any medical program. That's one of the reasons, I guess, and that's why it ends up being very competitive. And the GAMSAT and the GPA are what determine the invitation for interview, and then the interview score is added in for the final decision about who gets the places. That's why if you are from a rural background, particularly if you're from Southwest Victoria or the Grampians, which is our Deakin footprint, as we've called it, we'd very much encourage you to think about the rural training stream. That's very much the raw entry requirements are the same, but those 30 students won't be competing in the main pool for admission to our program. They'll only be competing with each other, all the people who've applied for the rural training stream. So that will make it, I think, a little easier to gain a position, because we're very keen to get students from a rural background, especially if they're from our patch, but from any rural background as a second preference in Australia. And there's a reason for that, but it's probably worth us talking about. One of the commitments we've made to our communities is that it's our job. Remember, I was talking at the beginning about our difference, what makes us different from the Melbourne medical schools. We've made a commitment to our communities to train health professionals, including doctors, to provide service to those communities into the future. We've learned that by placing students in a rural setting for a year, or even better, 2 years during their training, that increases the likelihood that they will practice rurally after they graduate and do their postgraduate training. We've also know that if they come from a rural background, that also increases the likelihood that that will happen. But what we've learned is if both things are true, then a very high proportion of those students, the ones from a rural background who've trained rurally, will actually end up practicing rurally. And there's a huge need for that in Australia. As you probably know, Australia probably does have enough doctors, they're just all in the wrong places. Getting them to move from Toorak to Portland is not the easiest thing in the world. So we're aiming to find people who want to work rurally in Australia to provide service to those communities where they will be really cherished. Those rural communities are so keen to have good doctors working with them that they are so welcoming and will really provide you with an excellent life. And I think after COVID and the Ring of Steel, people are actually a bit more interested in not being in Melbourne, should anything like that ever happen again. So we really encourage you to think about the rural training stream because, yes, entry is quite competitive.
Thank you, Gary. The next question is for Rachel from Kate. What is the best way to prepare for the GAMSAT?
That's a very good question, and a question I think everybody wants to know the answer to. Personally, I think it's great to practice the questions, to be honest, and in a time frame. I think you can get used to doing questions just casually, but under the time frame is critical. I know the one I did, they had a page mock-up and we were in there for like 7 hours. So it's great to sit down with the questions that they have available to practice. And also you can get them from other sources as well, other books. It's really, that's how I try and do it. And I know it's changed a bit now, the focus since I did it, but that's where I would be putting my study into, is just practice after practice after practice and try your best. That's all I can say. Try your best. And I know people in my year that have done it multiple times, so don't feel bad. Doesn't define who you are as a person. If you do it 1 year and you don't go as well as you planned, have another go. If you this is something you want to do, have another go. That's what I would say. I hope that answers your question.
Thank you, Rachel. The next one is for you again. It's from Harshita, and again, I apologise if I pronounced that incorrectly. She would like to know, they would like to know, what is your academic background?
My academic background is the boring old traditional biomed as a bachelor. I really enjoyed it, actually, to be honest. I did it at Deakin as well, and I loved it. I majored in infection and immunity, and then I did a honours degree in looking at the STAT5 protein, if anyone knows what that is, the JAK-STAT pathway, for a year, and then I applied to med and got in there. The good thing about Deakin is you can be from any background, and it's very valued. It's really valued, I should speak English, when you get into the course, especially in the PBLs and stuff. Having people from multiple backgrounds brings a lot of interesting things to the table, and it's really good to learn from that. I think you come out better at the other end, but everyone's valued. But yeah, that was my personal background.
Thank you, Rachel. I would just like to answer a general question from the audience about our website and whether it is going to be updated, and that is in progress at the moment. So we would suggest that you would please review this again within the next few days or next week. The information is currently in the process, as I said, of being updated. So thank you. The next question is for, sorry, I've lost my place. It's for Janet. And I think this is a really great question. It is from Anne. How is the Deakin Medicine program supportive of parents and families? Does the program allow deferral start dates or intermissions for pregnancies and parenting responsibilities?
Yeah, awesome question. And yes, I can give you lots of sort of examples in that. In terms of start dates, we don't allow deferrals into the program, so you're better off to commence with us or reapply if you can't start at the starting date. However, we have had multiple students who've come through who have started families, and there has been opportunity for intermission. We've also looked at potential ways to try and keep them in the program and get them catch up depending on if they're how long they've needed to take off. Of course, if you need to take too much time off the program, we certainly recommend an intermission, and we're very happy to support that. I can give you an example without hopefully giving away too much, but one of my students one year came to me and said, I'm pregnant with twins, and she was due just after or in the week of the Oskies, and she sat her Oskie, but the whole time we were like this, waiting to see what would happen. But there's lots of ways. We had set up a specific assessment for her to make sure that she could have a rest in between some of the stations. So there is lots of things that we can do to support students in those situations for sure.
Thank you, Janet. The next question is for Gary from Siobhan. Will the rural pathway limit my experience when compared to Metro?
Thanks, Siobhan. The answer is no. In the third year, you will either be at the Rural Community Clinical School, which we talked about a little while ago, where you get that very diverse experience of people presenting with all sorts of different problems in the rural setting, and you'll need to be part of the management. People in the Rural Community Clinical School often get much more hands-on experience because there are very limited numbers of health professionals in those towns, and so the student is, we'd like all our students to be part of the teams that they're working with and actually work hands-on, but that's even more so in the Rural Community Clinical School. But the other rural placements are in substantial hospitals like Ballarat Hospital and Warrnambool Hospital, both of which have a very wide range of services. And in fourth year, of course, all students do rotations through the specialties. So the answer is no, your clinical experience in terms of graduating with your MD would not be limited at all by taking part in training in a rural setting. In fact, what we're aiming for into the future, and increasingly this is possible, is for people to be able to stay rural for all of their medical training, so including their post-registration training. As you probably know, when you graduate as an intern, that isn't it. You need to do a year as an intern and then some years as a junior doctor, where you're supervised by specialists, including specialists in general practice, and then you undertake your own specialty training. And increasingly, specialty training programs are becoming available in our patch in Southwest Victoria and the Grampians. So we currently have a surgical training program where students work through Geelong and Ballarat and the smaller towns in the Southwest and the Grampians. And soon there'll be a physician training program as well for internal medicine physicians. And over time, there'll be more specialties where you can train entirely rurally. You don't have to. You as part of those programs, you can spend a year if there's a particular area that you're interested in within surgery, for example. You could do a fellowship or a year in a centre of excellence. All of these possibilities are there, but you can do all of your training rurally at this point, certainly in general surgery in Victoria. So that's terrific. But in terms of your training up to medical graduate level, up to the MD level, no disadvantage at all from undertaking your training rurally. Fantastic. Well, that brings us to the end of the seminar. Thank you all for your questions. As Claudia said, questions that are more focused on your own circumstances or any questions that we weren't able to answer this evening, we direct you to that number there, the Prospective Student Inquiry Centre, or PSEC, with that 1-800 number or the My Future email. We'd strongly encourage you to put your questions that way so that you're fully informed about our program. I'd like to thank my colleagues who are here this evening, Rachel and Janet and Claudia. Thank you very much. Also, thanks to the team behind the scenes for this evening's seminar. We hope you enjoyed it, and we hope to see you at Deakin sometime in the future. Thanks very much indeed. Good evening.